Uh, and Mark, what about the sort of the diversity of TCM?
Yeah, as I mentioned to you before, in the modern setting, acupuncture is very diverse in practice, which means that um, there are different schools of thought, many different traditions and many different techniques that someone can employ. So, for example, with acupuncture, some people you can use very fine needling, very shallow needling. Some people use slightly deeper needling, and there's many other very different techniques. Some people are specialise in using cupping and gua sha or scraping or moxibustion. They use lots and lots of moxibustion. Other people less so. So I think it's important to understand that there's always a diverse range of techniques, and you're not going to be with different practitioners. Many people have different styles of treatment. For myself, I like being eclectic in that sense, because the old classics, like in the Huangdi Neijing, the Yellow Emperor's Internal Classic, we'll talk about in different seasons and different times of the year. You'll use different techniques. So when it's winter, when it's colder, then you'll need a little bit more deeply, because the energy of your body gets colder. Like you want to sort of huddle up,
yeah.
And there's no warmth to your skin, so you'll be contacting the chi a little bit deeper. Whereas in summer, when you're hot, your skin's more red, the blood's more to the surface of the skin. So you might be needling a bit more shallowly. Or if someone has like a high blood pressure condition, then or lots of like a high stress or emotional condition, I find that the sensation that you'll get will be a lot more shallow. Whereas if you're treating a bony problem or a joint problem, you might need a little bit more deeply. So according to the old classics, you needle differently according to the condition and according to the season. So it's mainly has a very it's very adaptable in that sense, and in that sense it can seem very diverse because it has such a long history. There are many different schools of thought. Some people that focus on a particular theory of treatment or a particular style of treatment. Other people that focus on balancing the meridians. Other people that focus on tonifying the digestion as a means to health. Other people saying no, the basis of health is the kidneys. We always have to tonify the kidneys, because they get depleted. The kidneys in Chinese medicine are like your reservoirs of energy. So there are many different schools of thought over the couple of thousand years of history. So from that, then you get a wide variety of practice. So I think it's important to understand what the practitioner does, and to recognise that for different problems, then you might be treated in a very different way.
So is that like modern Western medicine, where it's become specialised? So you're dealing with an old science which is very broad, and has many different facets to it. So various practitioners, or certain practitioners might just focus on one particular point.
Yeah, you do get specialists. Some people who are dermatology specialists, or some people who are fertility specialists, or gynecology specialists. Especially in China, that's what happens. You'll go to the dermatology department, or you go to the internal medicine department if you've got a gastric upset. So it's very, you do get people who specialise, but I think the point I'm trying to make is that you can't pin it down to one particular definition. For example, Chinese acupuncture will often get a needle sensation, and then some people will say, like in China, sometimes they'll get the sensation very strongly, especially for pain problems.
Yeah.
Like one lady I treated when I was in China, I manipulated the needle and I got a sort of a numbing or throbbing sensation on the area, and then stopped. And she was like, "What are you doing? Keep going. I want to get better faster. More." But in Australia, many people are a bit more uncomfortable with that because they interpret that as pain. Not all people who practice Chinese medicine will get that sensation very strongly in all cases. It just does depend on the person's constitution and also their problem. But in China, they differentiate between there's about 4 or 5 different sensations that you can get. I think there's Ma, which means like numbness or tingling, and Swan, which is like a soreness or an achy sensation, then Zang, which is like a distending sensation or a dull ache, and then there's Tung, which is pain, which is when you get a superficial and sharp sensation on the skin. That's the only one we don't want. When you're in the hair follicle or the pore of the skin, then it feels uncomfortable on insertion, then you just take it out and then reinsert it. So obviously, like if you think about where the nerve ending is with the hair follicle, it sort of attaches onto the nerve, and if you're a bit close to that, then it feels a little bit sharp on the surface of the skin, because most of the time you don't get it, you don't feel it going in unless there's extreme tension. But and then some people who, in Australia, Japanese acupuncture is very popular, and then some people who'll use very fine techniques and you won't feel it very much. But you know, in my experience in Japan as well, it's about, and with people who've trained with Japanese senseis or Japanese teachers, you know, you will get some people who will elicit a bit more of a stronger sensation in some cases, and others who don't. So it's important to understand that it's very you know, it is very adaptable, but it does have a many and varied application depending upon the practitioner, because people have different styles. Like some people do very strong massage style, some people do a light massage style, some people will do both strong and light, you know, start off light and then go strongly. So it's important to understand that each practitioner will have their own experience and their own style, and I think it's about, you know, finding a practitioner that you gel with in that sense.
Yeah, so it's very much, apart from being a science, it's very much an art as well.
Yeah, it's long been regarded as an art, similar to like the martial arts, you know, are a means to self-understanding or self-awareness. So acupuncture can be. Well, often when we're doing needling, it's like I'll explain to people that it's like you've got to re-educate the body. It's like if the body gets into a particular pattern. I talked a little bit about in the paper, the article about the particular constitutional pattern. So if people get into a particular pattern of disharmony, whether that's a pain problem or like a stomach problem, for example, the body tries to adapt to it, and then when it gets used to trying to adapt to it, so it's like you've got to re-educate that body, re-educate the body to a more of a harmonious pattern. But at the same time, you know, we don't live in an ideal world, and there's lots of different stresses, and you know, dietary factors are not always ideal. So finding the nuances of treatment, I think, is really where the art comes in, because you'll get one person will not just present with one particular problem. Usually people are especially if they're a bit older and have had a complex history, they have a many and varied aspect to their problem. Like they might have a pain problem, but underneath that they might have another disharmony, and then over here there might be an inkling of another disharmony, you know, that's which represents like the pathogenesis or the progression of disease. So it's very much taking into account what's going on, you know, and then you know, I guess in a sense balancing that person can be very artistic, you know.
Excellent. Well, I'd like to thank you for sharing all of that knowledge with us, Mark.
Yeah, thank you very much for having me.
And I'm sure the viewers will certainly benefit from that video.
I hope so.
Thank you.
All the best.
Yeah.